When you have a problem with the heart, taking care of that heart right away is of utmost importance. I always tell my wife, you should never die of a heart attack. We should always be able to help you. And now at Mercy Hospital, the exact catheterization laboratories that we have at St. Francis, and I can tell you that's exact because I built them there, but it's not equipment that just fixes a patient, it's the staff. And what we've always been proud of St. Francis is that we have an incredible staff of physicians, but also the nurses, the techs, and everybody at St. Francis. It's a family. We're bringing the technology and the expertise, the know-how, the knowledge, and the great nursing care that you expect at St. Francis. You're going to get at Mercy Hospital.
And you guys are pioneers in this. People come from not only all over the country, but even internationally.
And we come up with a system here that we've actually developed at St. Francis that people are now using all over the world, where we call precision angioplasty. I really credit our staff. Our staff is amazing.
Well, you bring an important point. You have an incredible team here at St. Francis.
The staffing at Mercy Hospital is going to be a hybrid effort. What I mean by that is there are 20 interventional cardiologists at St. Francis Hospital. Those 20 interventional cardiologists are going to be available on an on-call basis 24 hours a day, 7 days a week. So that if there's an emergency in the middle of the night, the same doctor who would do your procedure at St. Francis is going to be available at Mercy. And in fact, two of our premier cardiologists have agreed, and we're very proud, that are taking the role of co-chair during the daytime. There'll be 3 or 4 cardiologists from St. Francis there, and we have the best of the best there during the day, and the rest of the team is going to be there at night. We've been training the Mercy staff, working at St. Francis with our staff, hand in hand, for months, bringing them up to par. But we're not leaving it just as that. Our staff is going to be rotating as well, so there'll be a hybrid staff. So we can guarantee that same quality care both from physician and the ancillary staff. We are a system that's sort of like a bicycle with a spoke, and the areas that have expertise in different areas of the system can help each other. For instance, we have an incredible heart failure program where people have weakened heart muscles. And we have a great team. We have an incredible left ventricular assist device team led by Dr. Lundy and Dr. Shah, one of the heart failure doctors. Well, they look at patients throughout our system, and if we can offer specialized care at St. Francis, which is not available at the other hospitals, we can then assist them. The same with complex procedures, whether they're angioplasties or open heart surgery. So if you're a patient at Mercy, and you have your emergent procedure, but something more complex is required, where you need an operating room, possibly in backup, or a complex calcified ablation of an artery, you're part of our system. We can get you to St. Francis, and you'll have immediate access by ambulance to get over as soon as possible when needed. The message that the board at CHS wanted to get across is they're very proud of the job that St. Francis has done over the years. The best care you can get in the world, and the safest, as in St. Francis, we're now offering at Mercy.